Treating and preventing dry eyes causes, symptoms, and solutions. Dry eye syndrome is a condition of the tear film that causes discomfort and irritation due to insufficient tear production or excessive evaporation of the tear film caused by damage to the exposed surface of the eye from the spaces between the eyelids. Dry eye syndrome can be caused by various factors, but it can be broadly classified into two categories: insufficient tear production and abnormality of the tear film, which leads to rapid tear evaporation. The following are some of the reasons why dry eye syndrome occurs. Firstly, inflammation of the eyelids can lead to decreased tear production due to dysfunction of the accessory lacrimal glands. Secondly, when wearing contact lenses, tear evaporation increases, and when worn for a long time, the reflex tears decrease because the corneal nerves become dull. Thirdly, dry or windy weather, exposure to heaters or air conditioners, increases tear evaporation, worsening dry eye syndrome. Fourthly, autoimmune diseases such as Sjogren's syndrome, rheumatoid arthritis, lupus, or decreased tear production with age can also cause dry eye syndrome. Women, in particular, experience more severe symptoms after menopause. Fifthly, taking certain medications such as allergy medications, high blood pressure medications, anti-venous medications, antidepressants, and Parkinson's disease medications can decrease tear secretion. Finally, prolonged use of televisions, computer monitors, smartphones, etc., can reduce the frequency of blinking and cause excessive tear evaporation by looking at the screen with wide-open eyes. Patients with dry eye syndrome experience various symptoms, including stinging, burning, itching, foreign body sensation, stiffness, soreness, heaviness in the eyelids, eye fatigue, and more. There is no specific sensation of dryness on the ocular surface, which leads patients to express their symptoms in a variety of ways. Sometimes, patients even complain of increased tearing, which can be explained as a reflex action to stimuli such as foreign body sensation. There are two characteristics of the symptoms of dry eye syndrome. First, symptoms may vary during the day, worsening at night or when waking up in the morning. Second, symptoms worsen due to continuous eye concentration, such as reading or watching television, and in conditions such as air conditioning, smoke, or low humidity inside airplanes. The basic treatment for dry eye syndrome is artificial tears. Artificial tears add moisture to the eye surface, relieve discomfort and store moisture for a long time, making the patient's eyes more comfortable. As many types of artificial tears are currently available, it is important to consult with a doctor to use the most suitable one. Since some artificial tears contain preservatives for the purpose of preventing bacterial infection, they may have a toxic effect on the eyes. Therefore, it is desirable to use artificial tears without preservatives when severe dry eye syndrome requires frequent use more than 4 times a day. If you experience difficulty opening your eyes due to dryness in the morning, using a lubricant ointment before bedtime can be effective. However, these ointments can cause blurred vision when used during the day, so it is best to use them in small amounts before sleeping at night. For severe dry eye syndrome, autologous serum, made by purifying a patient's own blood, is used as an eye drop. Various growth factors and vitamin A in serum help maintain the ocular surface. Eye drops containing cyclosporin A are effective in treating moderate to severe dry eye syndrome by suppressing the destruction of lacrimal glands with anti-inflammatory effects. When dry eye syndrome is related to inflammation of the eyelids, it is good to massage or clean the eyelids, and topical or systemic antibiotics may also be used. In addition to the above treatment methods, it is helpful to prevent a dry environment, as this reduces the evaporation of tears. For example, in winter when heating, it is good to hang wet laundry or use a humidifier to increase humidity, or to lower the indoor temperature slightly. In addition, when going out, it is recommended to wear protective glasses, and when reading a book or using a computer, it is good to take a break every 30 minutes.